Okay, it is a little after 3 East Coast time. It is another edition of Dr. Yass Live on YouTube. YouTube Live, yes. And today we are going to be discussing something that I was actually asked to perform. Usually, when I discuss pain, I have a tendency to focus initially on where the existing system is and its ability to diagnose and treat pain and why chronic pain exists and what are the improper techniques being used. And so I've been working with this woman, and she's an optimist and believes strongly in the power of positive thinking. And so her suggestion was today, why don't you forget the section that focuses on what's wrong and why people aren't being able to resolve their pain, and try to focus more on just what makes the Yass method the Yass method. Let me just fix that so everyone could see that. And so the way she told me it, I thought it was really something worth giving a chance. Her point was that it doesn't really matter what people are doing wrong in terms of not being able to resolve their pain. What counts is what can you do to help them resolve their pain. And in her particular case, she had a neck surgery after having pain around her shoulder blade for about 30 years. And she wasn't able to get it resolved. She found out about me, I think through the PBS special that I did. And so we started working, and she's seen a massive improvement. And then she went on to tell me about the symptoms she's having at her foot, and that it's impeding her from being able to do things that she's passionate about, like hiking or swimming. And so we worked on that, and then just a couple of weeks later, she was pain-free. So she felt that the important point that I should be making is that regardless of where you're having pain, from the neck to the foot, the Yass method can resolve those symptoms once shown to be muscular in nature. And the essence of what we're trying to get across is that weakness or imbalance is what is leading to dysfunction. So to develop functionality and do the things you want, ultimately you need to develop strength. And so probably from the very, very beginning, inception of the Yass method, the famous quote that I had always had was strength equals function. And I had mentioned it to her, and she said, could you just elaborate on that a little bit more? And so at the core of the Yass method, first is a diagnostic model. There is no question. And that aspect relates to the idea that to identify the tissue in distress, you need to interpret the symptoms, because the symptoms that you're experiencing are actually being elicited by the tissue in distress. Its purpose is to create conscious awareness of the distress of that tissue so that an intervention can be performed. Once the distress of that tissue ends, there's no need for it to elicit the symptom anymore, because the distress is over. So now it ceases, okay? What I was able to show over 27 years was that in more than 98% of cases, the cause is muscular. Literally, the tissue in distress eliciting people's symptoms is muscle. The other point that I was able to show was that there is a connection between the symptoms and dysfunction. That, in fact, it is the pain at the knee when you kneel, or the pain in your shoulder when you try to reach behind you, that is impeding you from performing that activity. And so there is a connection. And so from the very beginning, my question was, well, what is that connection? What is the connection between symptoms and dysfunction? And ultimately, it came to me that it is muscular deficit. It is the muscle that is responsible for both eliciting the symptom and creating dysfunction. And this, as this woman, Jennifer, mentions, is apparently revolutionary. And she has been to many practitioners of all nature. And so she has not been able to get any resolution. And as a result of that, she's been frustrated and living a life that's not fulfilled. And so when I started treating her, and we very quickly were able to get this change, she said, this is the point you need to explain to people, regardless of where people are having pain from the neck to the foot. Your method is capable of resolving the deficits associated with both the symptoms and the dysfunction. Hi, Leanda. I'm sorry I haven't gotten back to you yet, but it's been a bit chaotic since I started doing these again. I've been getting kind of bogged down with requests for Skype and Zoom sessions. I promise you by tomorrow, I will definitely get back to you and we will schedule a Zoom or Skype appointment for you, whichever you want. We should be able to get it in sometime next week or the week after. Or if you're available after 8 during the week, I'd be happy to do it for you. So I promise you, I will definitely get to you. I just apologize. It's very interesting. It's very strange how when the coronavirus thing began, it seemed that there was this massive focus on it, even apparently for those people who were suffering from chronic pain. So for about a 4 or 5 week period, I went completely silent. I was getting no emails, no requests for evaluations or Skypes. And over the last 2 or 3 weeks, it's just begun to come back very heavily. Probably partly because I am putting out a lot more content on the internet. And I think that is starting to help create more awareness of what I'm doing. So I apologize, and I will definitely get back to you by tomorrow and we'll schedule something for you. So I thought what I would like to do today is go area by area and see if I could describe what the typical symptoms that people describe, what the muscular deficit is that's associated with it, and how the Yass method would actually work in resolving those symptoms. And hopefully for those people who watch the video, it's going to probably hit on some type of symptom that they're experiencing, and where they haven't gotten an answer or a solution to resolving the symptom, maybe this will ring true to them. And then they'll be more apt to want to investigate the Yass method further and seek care through the Yass method, which, as Jennifer oftentimes talks about, is unusual. As she describes, it is miraculous and not miraculous at the same time. And the miraculous part she describes is the fact that I came up with it, that some guy individually recognized this connection and that the existing system wasn't finding muscular causes. But in terms of its ability to work, it's fairly straightforward. It's not extremely complex. It's basically trying to say that certain muscles are required for function. When we can identify the functional test that's limited, and you know which muscles are involved in that task, you can actually go through the individual muscle tests, look for postural variations or functional variations, and be able to pinpoint which muscles are responsible. And then it's just the process of isolating those muscles using progressive resistance to make the muscles stronger, to where the force output of the muscles is greater than the force requirement of your activities, and you're pain-free and fully functional, as Jennifer has found out. And many people have as well. I think Leanda, I helped at one point. Diana oftentimes is on here listening, and she's become a big advocate for the Yass method because she's seen it work for her after years of not being able to resolve her symptoms. So let's start with a fairly commonplace, and that's kind of in the neck area, right? This upper trap area here. And let's say that someone was having pain along the entire upper trap region, both sides. What would be the possible muscular cause for that situation? And the answer is that you have your chest muscle, your bicep, and your anterior delt. The muscles in the front of your body have a tendency to be stronger than the muscles in the back of the body because we do everything in front of us. We carry things, we reach for things, everything is done in front. So these muscles have a tendency to be stronger than the muscles in the back. And in them being stronger, they'll have a tendency to shorten. So what happens is that you would see the shoulder come forward. You see how my shoulder's here and then it gets drawn forward? Well, that would cause the distance between the spine and the shoulder blades to increase. So if this is the spine and this is the inside portion of my shoulder blade, if the shoulder rounds, this gets farther away. Now, the muscle that supports the head is called the levator scapula. Most people, when they have pain in this area, will say something to the effect, oh, I can feel it starting between my shoulder blades. That is because the levator scapula actually starts at the inner upper point of the shoulder blade and goes diagonally to the upper cervical region. So if that muscle were to become overstretched because of this change in posture, it will lose its ability to create force and support the head. The head still weighs the same, but the length of the muscle changing makes it lose its ability to create force and support the head. So it strains. So you have pain here, and the natural tendency is to think, well, that's near the cervical spine, so it must be cervical spine related. This muscle is called the levator scapula, Latin for elevate the shoulder blade. So if you recognize that as its name, it would imply that it's not related to the cervical spine. It's related to the shoulder and shoulder blade complex, levator scapula. So once you recognize that this is strained, you would have to assume that it's somehow related to the shoulder and shoulder dysfunction, which is my point, is that the position of the shoulder, the arm bone in the shoulder joint has changed. That's what has to be corrected. We can't live comfortably and have a healthy levator scapula with a shoulder that's all the way forward. So we need to pull the shoulder blades back, the shoulders back, and pull the shoulder blades back in line where they are in relationship to the spine. This occurs by strengthening the upper back muscles from across the shoulders. There are the muscles that sit between the shoulder blades, called the rhomboids and mid-traps. There is the muscle that sits below that, which actually runs all the way down to the bottom of the rib cage. Just wrap your head around this idea. There is a muscle that runs along the thoracic spine all the way down to the bottom of the rib cage, which is actually attached to the shoulder blade, called the lower trapezius muscle. That muscle is critical for pulling the shoulder blade back and down, which is exactly the position you would want to develop proper shoulder position. So just imagine if you had pain all the way down near the thoracic spine, just above your rib cage, you would assume that relates to your back, when in fact, that's the lower trapezius muscle, and that symptom actually is a result of shoulder dysfunction. You would need to strengthen the muscle surrounding the shoulder and shoulder blade to fix a pain that's in the lower thoracic region. This is where an understanding of muscles, how muscles work together to create specific functions, how joints work, how muscles relate to the way joints work. All of this understanding is what allows you to recognize the interplay between strength and function. So in doing that, I've been able to clearly recognize that this is actually associated with this. Okay, now let's say that instead of it being on both sides, it was just on one side. So here's kind of the funny thing that you start finding about this stuff. Different symptoms relate to different causes. Pain on both sides, as I said, relates to forward shoulder posture. But pain on one side doesn't relate to forward shoulder posture. Because if you had forward shoulder posture creating pain, and it's both shoulders with forward shoulder posture, you should have pain on both sides, right? That's logic. So when it's on one side, it's something different. And what that relates to is the overall strength of the particular shoulder you're having the symptom on. That's what makes this different. So now beyond this imbalance of positioning the shoulders, now we're looking at how do all the muscles relate to the way the shoulder functions. So now we have to bring in a completely separate muscle group, which most people have heard of, known as the rotator cuff. All you hear are these terrible things about rotator cuff tear, need surgery. Well, that's actually a complete fallacy. It turns out that for the vast majority of people that are having some sort of dysfunction and pain associated with the shoulder blade, they have a rotator cuff strain, not a rotator cuff tear. What is the difference? A rotator cuff strain implies that there's a certain, look, I'm raising something. Gravity's pushing down on me. For me to raise this thing, I need the muscles to be able to push up against gravity. That's a force requirement. The rotator cuff is responsible for keeping my head of my arm bone in the shoulder joint so that the muscles that are attached from the arm to the shoulder can pull my arm up. Well, if that muscle is weak, it's going to strain. Does straining imply tearing? Has there been some ripping? Is there some sort of bleeding? The answer is absolutely not. Absolutely not. So for all those people that they have full range of motion, but they have pain, unless you can tell me you had some sort of bleeding, there was some sort of acute situation, you fell off a ladder, you fell down a flight of stairs, you cannot assume that a rotator cuff tear has occurred. And in fact, you simply have a rotator cuff strain. This is a massive, massive thing that must be understood. Because what would happen is you would go for an MRI. They're going to show you that you have a rotator cuff tear and assert that's what's creating your tear, creating your pain. But what you must understand is that 90 to 95% of all those rotator cuff tears they're finding are degenerative. They're not acute. What's happening is those muscles are weak, and the rotator cuff is having a real tough time doing its job. So it's straining. And what's happening in oftentimes is you're getting these very, very, very slow kind of degenerative tears. It's almost the equivalent of a wrinkle. It's happening over years. And as a result of that, a tear might show up, but it's degenerative in nature. It is not what's eliciting the symptom. It is the strain of the muscle. When a muscle strains, this is an important thing to understand. Muscles have a certain fiber length, and there's fluid in the muscle. And the fluid acts as a lubricant so that the two proteins that join together to create muscular contraction can grab one another and create force. But when the muscle strains, the body says, I am afraid you're going to tear, and I don't want to take a chance. So what happens is the body converts that fluid, that water, into an Elmer's glue. Literally a gluey substance. And what that does is it binds the fiber together. If you bind the fiber together, the muscle is incapable of creating its optimal force and tearing. So what you find is that straining is the body's attempt to prevent against tearing. That's why it's so hard to tear a muscle. In most cases, an external force is going to be required for somebody to tear a muscle. I went to throw a ball and someone grabbed my arm and pulled it back. I was running and somebody hit me on my leg. It's that kind of stuff. The average person is not going to tear a muscle. It's very unusual. Tears are typically associated with sports. The average person who's doing stuff, daily activity, is not going to create a tear of an acute nature. If anything, they might create a chronic tear, a degenerative tear, but that doesn't elicit pain. So do we understand now what a strain is versus a tear and how a strain develops and what is the purpose of the strain? To prevent the muscle from tearing. That's what's critical to understand. If we get this, then it kind of starts to make more sense what we got to do. So let's say, for instance, you strained your rotator cuff and it's very painful raising your arm. You're going to need to strengthen your rotator cuff. So what you want to understand about that, let me just see, I think. Okay, come on. Okay. So Jennifer, the actual girl who I was talking about, listened for a little bit, but she had to go. So that's what she was telling me. Okay. So if we need to strengthen the muscle, let's talk about where we're starting. So we have this muscle that's all bunched up, right? That fluid turned to Elmer's glue. So the muscle by nature is going to have a very difficult time eliciting force. So we can try to strengthen the muscle in the appropriate way, recognizing that because it's at this very shortened state, less than its normal shortened state, or its regular state where it would be at rest because of this strain and thickening. So it's going to have a problem. We're going to have to be very careful at how we start this exercise. We want to make sure that we're going through the exact range of motion. We want to make sure that our technique is pure. And we want to make sure that we're using a resistance level that's like, I would start if someone had a lot of pain, it's somewhere around 5 to 6 out of 10. This is what is known as the perceived exertion scale. What the perceived exertion scale is talking about is how hard do you think you're working when performing the exercise? A 10 would feel like you're working so hard you're going to tear a muscle. A 0 would feel like you're doing absolutely nothing. Now, typically, as you're doing exercise, it is recommended that you perform the exercise at an 8 out of 10, 80% of your maximum effort. That's where it's been shown where you could get the maximal amount of force output with the least chance of injury. But if you're having a lot of pain, you might be hesitant to do that. So you might want to start at a 5 or a 6 out of 10. That represents 50 to 60% of your maximum effort. And that's probably going to be a very safe force exertion level. And the amount of force will be good enough that you'll begin to grow muscle. You'll get stronger without straining it further and eliciting greater pain. Eventually, as the pain disseminates, now we do want to try to work at an exertion level of 8. And so what we do is we'll set the resistance. We'll have our hand, say, a certain distance away from the point at which the resistance is being held. And we're going to do an exertion level of 8. We're going to maintain this exact setup. And what's going to happen is our muscles really going to start getting stronger. And I don't think people understand this idea. When you are exercising and you're doing a strength training exercise, you're actually causing micro tears in the muscle. You're not growing muscle when doing the exercise. You're creating micro tears in the muscle. What will happen is, as a result of that, the body will create an inflammatory response and will heal the muscle by creating more muscle. So strengthening is actually an attempt to create micro tears in the muscle. The body then heals in the next 24 to 48 hours by growing muscle. Okay, so that's what we're trying to do. So at an 8 exertion level, 8 out of 10, it's been established. That's where you're going to get the greatest chance to get growth without straining. So we're going to stay there. Everything is maintained, and eventually your muscle's going to grow. You're going to make more muscle mass. And that same level of resistance is now going to give you an exertion level of like 5 out of 10, right? Once you hit 5 out of 10, that's told you your muscle has adapted so well and made muscle that now you need to increase the resistance to continue the process of growing more muscle. So the way we do that is we're going to grab the band in a way that we're going to grab it lower towards the attachment point, or we're going to move farther away from the attachment point if that's possible. Either way, we can make more resistance, or we could just go to a thicker band. One of those 3 ways, you're going to make more resistance. What you'll do is you'll now create that greater resistance back to an exertion level of 8. We stay at that exertion level of 8 with that same formula, same distance away, same resistance level. Muscle's going to adapt, get stronger. You're going to go down to an exertion level of 5. Then we're going to do the same thing. Increase the resistance, move away, get a thicker band. Somehow you're going to increase that cycling of increasing resistance, adapting to resistance, increasing resistance, adapting, is known as progressive resistance. It is the primary core component of Yassercise and the mechanism by which the Yass method resolves muscular deficits. So what's very important to understand, and I think a lot of people don't understand this, is there's this perception that doing exercise is good. That somehow by doing the exercise, you're benefiting yourself. But when it comes to strength training, that's simply a falsehood. If I was using a 5-pound dumbbell and I was doing, say, external rotation, this exercise, and a year from now, I've been very good 3 times a week, I've done the exercise, I've used the 5-pound dumbbell, and a year from now, the question to you would be, is my muscle any stronger? The answer would be no. Why no? You've been very diligent. You've been doing the exercise 3 times a week for the year. The problem is you have not increased the resistance to cause the muscle to adapt and grow more muscle mass. So as much as you were diligent, you didn't accomplish anything. And that's the thing I don't think people understand. I just treated this woman and she said she'd been getting personal training and You know, he's got doing all these exercises, and he's telling you like using 10 pounds for every exercise. And it's just foolish to think that your front thigh muscles, your quads, which are the biggest muscles in the body, are going to use the same resistance as your bicep. Your bicep, this is as big as your thigh, and yet they're using the same resistance. And you have to say to yourself, wow, what's the point? To simply do the process of going through the exercises, that does not have value. You are doing nothing to benefit yourself other than possibly psychological, in that you're saying to yourself, look, I'm caring for myself, and that's a good thing. But my attitude is, why not care for yourself, do the good thing for yourself, and benefit from it the way you're trying to? Diana wrote, are resistance bands better to use than machine weights? They're completely different in a couple of key things. Number one, here's the thing that makes resistance bands different from other forms of resistance. A weight or a machine weight is what is known as isotonic, meaning that there is equal amount of resistance through the motion of the exercise. Would you acknowledge that if you're using a dumbbell, regardless of where you are in the motion, it is still 5 pounds? The same thing can be said for the plate weight. Same exact thing. With a resistance band, as you pull it, there is an increasing resistance level. So that is not isotonic. That you have to be conscious of, because as I'm doing, say, a bicep curl, and I'm pulling like this, as I'm getting to this shortened position of the bicep, that happens to be where the highest level of resistance develops, which could potentially make that a little bit dangerous. So you want to be conscious of that when you're using a resistance band. What's the positive side of the resistance band? Well, it's so easy to use. It's so easy to transport, right? There's no exercise. No, if you give me a door, a frame, a door frame, a chair, and a band, there's not a body part I can't work, not a single exercise. So in terms of utility, it's incredible, right? And it's very easy. I take it out, I move it, all right? So it's very easy. The downside of using machines is that if you look at a machine, there's a certain pivot point at which the machine moves, and that machine pivot point is in an isolated specific location. Let's say we're talking about a knee extension machine. So the pivot point should be in line with my knee, and I kick out. Well, I could pretty much guarantee that not everybody has the same length thigh that I have. Therefore, for somebody, that pivot point is either going to be too far in front of my knee or too far behind my knee joint, the center line of my knee joint. So as a result of that, it could potentially create undue stress on the joint. The force is not running directly through. It could be here or here. And that could potentially injure the knee joint. So again, there's a conscious awareness that has to be made that when you're trying to set yourself up, you get yourself to the best alignment. And when you're in a gym, the odds of someone being able to understand this might not be there. Plus, the machine doesn't really, in the instructions, it doesn't really give you this fine detail to let you know exactly how to align yourself. So that's the downside of that. If you're asking what the best thing to use is, it's free weights, because you get the best of all worlds. A dumbbell will always be the same exact of weight, regardless of where I am in the range of motion. And there are no pivot points to align with the machine. I simply move my joints in their natural range of motion. So if you're asking what is the best type of equipment, most effective, it is dumbbells and barbells. But can everyone have that accessible to them? The answer is no. I would imagine in 90% of the people I've ever treated, they didn't have access to a gym. That's where the idea of the resistance band came in. And they've just so advanced resistance bands now. Gold's Gym, and I'll plug Gold's Gym because I think it's the best band right now until I create my own. But Gold's Gym, and you can get them on Amazon.com. The Gold's Gym 6-foot resistance bands, they come with a red, a blue, and a green. They are really good, thick material. They will last you for months. And they're very effective for home use, travel, things of that nature. Leander wrote, I was doing so well when the gym was open and using their machines, and I was able to work out there. Now I had to buy new bands so I can work again and home. Yeah, I wouldn't deny. I mean, there's a lot to be said for working out at a gym. There's a certain atmosphere that I think is a component of it. you know, as you get stronger, right, the gym has all the weight you need, and the machines are plate loaded a lot of time, right? So you have the weights are stacked already, so you just have to stick that pin in and out. I mean, there's a lot of benefits to it. So yeah, I wouldn't deny that it's wonderful to be able to work out at a gym, and you're not going to get that same enthusiasm working out at a home with the band. But you look at this girl, Jennifer, who she has never had access to a gym, never wanted access to a gym. And yet over a couple of month period, she has achieved pretty much everything she's ever wanted with resistance bands. Like I said, these Gold's Gym resistance bands are just phenomenal. And, you know, so people always wonder, well, what's the thickest band they got? Okay, so let's say it's the green band, right? Let's say you get beyond the green band. Well, just combine the green and the red. Or combine the green and the blue, or combine the green. You could always add bands. You could always do 2 or 3 bands to get a higher level of resistance. Trust me, if you use the red, the green, and the blue band, you're probably using 70, 80 pounds of resistance. You would be as strong as can be, and that's just through the use of resistance bands. So, Daniel, for me, I had more pain working out at the gym at home with resistance bands. You're probably the type of person that wasn't educated appropriately enough to know exactly how to use the machines. And the machines always have those little stickers and stuff, but the fact is that the machines in many cases aren't really designed for everyone to use them. There's an innate danger in the use of the machines because they're really not designed for everybody. So, you know, it can be a problem. My suggestion is always, if you have questions, you come to me, right? So beyond the issue of how to diagnose and treat pain in terms of exercise, geez, way back 33 years ago, I decided to take a high school physics course and apply it to weightlifting. That's how I was able to put on 60 pounds of muscle. And it gave me an advantage over everybody in treating people because I have this very, very unique understanding. And the magic, I'll give you a little hint, is that people focus on the moving of the resistance and how perfect that should be. And there's no question that is a component. What people don't realize is the ability to stabilize the rest of the body so that all your energy is going to just the one muscle moving the resistance is probably as important, if not more important, not only for the actual moving of the resistance, but to prevent yourself against injury. Classic example. I had Jennifer last night. She was doing this exercise called inversion. It's just pulling your ankle in, right? And she was sitting up, slightly forward, where her shoulders were slightly in front of her hips. And she mentions to me that she's having back pain as she's doing it. So I said, watch how you can make that pain go away. Now lean back against the back of your chair. Your shoulders will be behind your hips. Now try to do the exercise because now instead of her supporting her torso, now it's being stabilized by the chair, the back of the chair, and just she's focusing on the ankle and the movement of the ankle. Sure enough, she had no pain, no symptom, right? The actual moving of the resistance was exactly the same, but the understanding of how to stabilize all the other rest of the part of the body was the key to understanding how she was able to do that without the symptom. So those 2 aspects are key. Not only understanding how to move the resistance optimally, but how to stabilize the body on the opposite side so that you're getting maximum stabilization and maximal force output to the muscle that's creating the force. Give me 1 sec. Great. Does everyone kind of understand that concept? If you have any questions, just plug it into the comments. So I just talked about the neck and how if you have pain on one side or pain on both sides, those actually represent different causes because they're representation of different symptoms. Pain on one side versus pains on both sides, literally 2 separate symptoms, okay? So you want to talk about shoulder. Let's talk about shoulder here, pain in the front of the shoulder, very, very common. What's causing that? All right, we're going to talk about the rotator cuff again because sure enough, this is the shoulder. So let's look at how the shoulder works. So what makes the shoulder the most interesting and complex of all the joints is the fact that it's the only joint that allows you to go through 360 degrees of motion. So as a result of that, for you to accomplish that, if this is the head of the arm bone and this is your shoulder joint, as you raise your arm, the head of that arm bone has to travel down a lot. It's called glide down, inferior glide. Now, if the elbow is trying to come up, the natural mechanics of the joint is for the head of the arm bone to come up. And this is the shoulder bone right here, right? So if the elbow rises, the head of the arm bone rises. But something has to pull it down to prevent it from rising. And that is where the rotator cuff comes in. The rotator cuff is attached from the head of the arm bone to your shoulder blade. And if you look at where the rotator cuff attaches to the shoulder blade, it's lower than the head of the arm bone. So when it contracts, it pulls the head of the arm bone down. So if the rotator cuff is working properly, this is what you see. If it's not working properly, this is what you see. Now, what runs right here is your bicep tendon. Most people think of the bicep as the upper arm, but the upper arm actually runs by a tendon through the shoulder joint. It actually runs over the top of the head of the arm bone, under the shoulder bone, between the two. So just imagine if you're not getting that rotator cuff to drop your shoulder bone or your arm bone, this is what's happening. You're pinching your bicep tendon or impinging on the space below the shoulder joint known as the subacromial space. So pain in the front of the shoulder is not going to be arthritis. That doesn't make any sense. It's muscular, and it is, you can actually press. You'll feel there's a gap right in the front here. There's two big protuberances that stick out on the head of the arm bone called tuberosities, and right between them is a groove, the bicipital groove. And that's where you would feel your bicep. And if you press and you feel pain here, well, you're actually pressing on your bicep tendon. And that is indicative of impingement syndrome. Impingement syndrome is a representation of the inability of the rotator cuff to drop the head of the arm bone down when the shoulder is rising to clear the shoulder bone and allow this to happen properly. It is actually rising and getting stuck. And it brings up a very important point. So you're a person and you go to raise your arm and you kind of see this happen. And that's as far as you could raise your arm. You can't raise your arm up anymore. You can kind of see, look what's happening right here. Can you see that it's going up? Why isn't it going up? Because the rotator cuff isn't pulling it down, right? So you could have a loss of range of motion and it be unrelated to a structural component. It could be muscular. Don't forget the position of the bones in a joint are based on the pulls of the muscles responsible for that. So this is a clear example where that limited motion, which you can see, this keeps coming up, is due to the inability of the head to drop down because your rotator cuff isn't working. All right, so that's the shoulder. We could go to the bigger ones right now. Let's talk about the lower back. Same concept, same concept. If you have pain on one side of the lower back, that is different than pain on both sides. I'll say it again. Pain on one side of the lower back has a different cause than pain on both sides. Does everyone acknowledge that pain on one side is kind of different than pain on both sides? It's actually a different symptom. And if it's a different symptom, it must have a different cause, right? Diane wrote, so many people are still doing one kind of exercise, like jogging. So we are really creating an imbalance, only doing one kind of exercise, right? It's not so much that you're doing one kind of exercise, it's that you're doing an exercise that use groups of muscles to perform it. If you're using groups of muscles to perform an activity, an exercise, anything, then that's telling you that if all the muscles aren't strong enough, then whatever muscle is weak cannot participate. It's simply not capable. So you will end up compensating in how you do the activity. In doing the activity, say jogging or walking or any other activity, if there's a weakness, doing the activity doesn't isolate the muscle that's weaker in balance and correct it. You just end up compensating, and by definition, compensating implies that you're going to continue to do something that wasn't designed to happen. So as a result, the muscle that's weak continues to weaken and eventually may lead you to not be able to do the activity at all. So the answer is, in doing activities, even exercise-based activities, if you are not doing isolated strengthening, known as Yass, and making sure that all your muscles are strong and balanced, then you will continue to have deficits performing these exercises, these types of exercise, and that's what you see, right? How many people do you see out there with a normal kind of jogging pattern? You see people leaning forward, you see people wobbling, you see people not fully extending their knees, you see, and then of course you see them with the knee braces, the ankle braces, the 20,000 different appliances, right? And what is this all a representation of? It's a representation of people who are just trying to get through and complete the activity, but without doing it properly. And that's why you see all these weird presentations and use of all these devices. They're taking the wrong road. They're putting a Band-Aid on the inability to run by using appliances or altering how they do things, versus saying, well, there's a reason that I'm not using the mechanics properly, which must represent some sort of weakness or imbalance. Let me see if I could go through the process, identify where the weakness or imbalance is, correct that, and then I can have this incredible, you'll be like a freaking Kenyan. Everybody should do homework. If you're a jogger, and go Google a Kenyan runner, a marathoner, and you'll see everything about it is absolutely perfect. His shoulder or her shoulder is directly over the hip joint. They fully extend the knee. They reach with the toe. They have full stride lengths. It's beautiful. It's absolutely, and that's why they're so efficient. And they don't have injury, right? Because they have learned the technique and the use of all the appropriate muscles correctly. So that's the story with that. So let's go on now to the lower back. If you're having pain on one side, do not think that this is an issue of forward and back, muscles in the front of the body and muscles in the back of the body. You're going to have to assume that it's a side to side. If you're having pain on one side of the lower back, all you have to do is put your hands on top of your pelvic rims. Most people, when you play the game, you put your hips in, you put your hips out. So if I said that, put your hips in, people always put their hands on the top of their pelvic rim. That's actually not your hip joint. The hip joint's about 4 to 5 inches below on the side where you'll feel that protuberance. But I want you to put your hands on the top of the pelvic rim. And you would probably find one is higher than the other. And what that represents is an altered posture associated with a weak muscle that sits on the side of the hip. The side of the pelvis called the gluteus medius muscle, and it's responsible for maintaining normal pelvic balance and keeping your pelvis level. So when your pelvis is level, the distance between the rib cage and the top of the pelvis is equal. So the length of your lower back muscles will be maintained, and you're not going to have pain in that respect. But if you have a pelvic hike on one side, well, now the distance between the pelvic, the bottom of the rib cage and the top of the pelvis has changed dramatically. This one's like this, and this one's this way. Well, that muscle that's shortened is probably going to strain and elicit pain. So what's going on there is that you have this glute med that's supposed to keep the pelvis level. If this side was weak, it would allow this to drop on the opposite side. Once that happens, the foot on this side gets closer to the ground. You can catch your foot. Your body's never going to allow that to happen. So something wants to try to help to bring it back up. And that happens to be the lower back muscle here between the bottom of the rib cage and the top of the pelvis. So it's pulling it up to try to assist the glute med on the opposite side. The problem is that the low back muscle wasn't designed to assist the gluteus medius. It was designed just to allow weight to be transmitted from the upper body to the lower body to the floor. So as a result of this, it's doing the job it wasn't designed to. It strains and elicits pain. And ultimately, because it's overworking and strains, it shortens. So you see pain at the lower back muscle, and you see the pelvis higher on that side. That situation is representative of a cause being the strained gluteus medius on the opposite side. What is this telling you? Another Yassercise rule, another Yassology rule. Where you're having your pain in 99% of cases is not where the cause is. Critical to understand. If you think you're going to go to your lower back where you're having pain and think you're going to find the cause of it there, you're very wrong. You're going to have a lot of problems. Here's a situation where you have pain on, let's say, the right lower back. You're going to have to look to the left side of your pelvis to find the cause. Okay? So if we have pain on one side of the lower back, start to think of that as a problem in balance side to side. And we're going to have to identify which glute med is creating the symptom. What about pain on both sides? Just like with the neck, the pain on both sides of the lower back represents some sort of imbalance front to back. And if we look at the way we move when it comes to the legs, we use our legs. We walk in front of us. We walk upstairs. We kneel down. We do everything in front of us. Therefore, the front thigh muscles are much stronger than the back thigh muscles. And as a result of that, the quads will have a tendency to be stronger and shorten. Because they're attached to the front of the pelvis, they'll pull the front of the pelvis down, causing the back of the pelvis to rise, which creates, instead of a very subtle, normal arch in the lower back, you're going to get an extreme arch. And look at what happens. These two get closer. So the distance between the rib cage, bottom of the rib cage and top of the pelvis get closer, which causes the low back muscles to shorten. So if you're having pain across your lower back, the best thing to do, and you're noticing that there is a correlative excessive arch in the lower back, go and try to stretch your quad muscle, your front thigh muscle. Stretch them for 20 seconds on each leg, and now go and see if the low back pain has improved. See if you could bend forward with greater range of motion. If you can, you have just reinforced that the reason you're having your lower back pain is that your front thigh muscles are stronger and shorter than the hamstring posterior thigh muscles. And all that has to be done to resolve that lower back pain across the entire back is to stretch the quads and strengthen the hamstrings. Again, if everybody's watching this and you're not sure, it doesn't make sense, or if it does make sense, just let me know. If you want me to review it again, I can continue to review it. Again, what are we learning here? Where is the symptom? The lower back. Where is the cause? The front thigh. Not even close to where you're experiencing that pain. All right? If you want to talk about the hip region, that's a whole separate set of issues. So I'm just going to stand up and show you. Let me just see if I can get you to see this. I think we can get it. I'll put this down a little bit. So we talked about, this is the top of my pelvis. This is the top of my pelvis. Remember I said that? Put your hands here. Look how far down. I keep coming down. I keep coming down. Right here. This is my hip joint. Right here. I can feel the head of the trochanter, which is the head of the femur, going into my hip joint. So this is not my hip joint. This is my hip joint. So if someone was to say you have pain at the hip joint, it has to be here. Pain here, pain here, pain here, pain here, pain here, pain here. None of that is the hip joint. Only here. Everyone can stand up and do it if you want. This is your hip joint, okay? So if you have pain any of these other locations, that is not your hip joint, and it's muscular. Muscular. So what are the possible muscle causes? Let me just see. What can you do if cramp up immediately when stretching quads? Very, very good. Very good point. So here's a good example. I like what Leanda had mentioned. So let's say you try to stretch your quads and your hamstring goes into cramping. It actually represents that the hamstring, okay, if the quad is severely short, for every muscle, there's an opposing muscle. So if the quad is very short, it's actually going to represent a hamstring that's excessively lengthened. It's hyperflexible. And when you go to passively try to stretch it, it could actually cramp out. because it's so shortened, it's at a point where it can't allow the fibers to pass one another again. That is such a great point. So what you want to try to do, Leander, is instead of trying to grab your ankle and do it yourself, I would say have a chair in front of your bed, face away from the bed. Put your ankle up of the muscle of the leg that you're trying to stretch on the bed, leaning away from the bed. Hold on to the chair, and now try to do the stretch by going down, bending down. That's the only way you'll be able to stretch the quad without you actively trying to participate with your hand. You can control the stretch a lot easier if you do it that way. If anybody is not sure about what I'm saying and you want, let me just, if I can. So if anyone has any questions about anything I say and they want to contact me directly, and I'm okay, never have a problem with that. I'm just putting in here my email address. Okay, so there's my email address, drmitch@mitchellyass.com. If you have any questions about what I'm saying, you know, Leanda's going out. She's talking directly about her own personal situation. If you don't feel comfortable with that, I don't have a problem with any of that. I'm always here just to let people know what I'm doing and discuss things. And if you want to participate, great. If not, if you want to talk personally, I'm always good with that. Let me see. Kathy Harvey, foot pain gone after getting your advice regarding my gluteus med. Wow. All right. That's cool. That's always good to hear. So foot pain gone. Ah, the foot pain. Ah, yes. So, all right. So can I move now to thumbs up? That's good. And so you'll notice I'm like a child. I get very, very excited about this because I really don't know why I know what I know. I went to medical school like everybody else, but within a week just recognized it didn't feel right to me. None of it made sense. And I decided I was going to try to figure it out myself. And I just feel very lucky, very fortunate that I could do this for people. It really means a lot to me. I'm very humbled by it. And I always see it as a gift. This is a gift that I'm trying to transfer to people. And so when someone tells me that they actually took what I gave them and they've benefited from it to the point where they are now in control of their pain and how to prevent it, it's worth $1 gazillion to me. It's always been that way for me. So that's why I seem a little goofy and I get very, very excited. So in case anybody else is listening, I'd like to try to give this to you. So foot pain gone after getting advice regarding the gluteus medius. This is a situation where the distance between the symptom and the cause is by far the greatest. So people have heard of plantar fasciitis pain. That is pain that runs from the heel, typically forward towards the balls of the feet. A lot of times it's like right next to the heel. Sometimes it goes farther into the underside of the foot. Okay, there is a cause for that. Why does the plantar fascia elicit pain? Well, the plantar fascia runs from the heel to the balls of the foot, and the thickest part of it runs on the more inside portion of the foot with the arches. Well, the gluteus medius muscle that Kathy's referring to, the gluteus medius muscle sits on the side of the pelvis, as I was mentioning, relates to the lower back. And when it weakens, remember how I said the pelvis can drop? Well, if the pelvis drops, can you see that if this drops, this pelvis starts to move this way? And since this is the inside of the body, it's actually going to cause your center of mass to move more towards the inside of your foot. So instead of weight bearing through the middle of the foot, when you have a strong gluteus medius, you weight bear more on the inside of the foot. So as a result, your force load is going through the arch. So there's an excess load that's on the arch that wasn't designed to be there. So as a result, the muscles that support the arch have to work harder. What are those muscles? The anterior and posterior tibialis muscles. Well, eventually, like I said, it's a load it wasn't supposed to take, right? So it strains, they strain. And as a result, you lose your arch. Now watch, if this is an arch and this is the distance between the balls of the feet and the heel, watch what happens. Can you see that this distance got very, very big? Here's the arch. Here's the no arch. Look at that increase in distance. Remember, the plantar fascia attaches from the heel to the balls of the feet. If you stretch out the heel and the balls of the feet, you're going to overstretch the plantar fascia and it's going to get painful, right? So all I mentioned was that what you need to do is strengthen the gluteus medius muscle to keep that when you take the opposite foot off, the pelvis doesn't fall. It actually remains level. And as long as it's level, if you're standing on that foot, you will see your weight bearing through all 5 balls of your feet, not the first and second ball of the foot. So strengthening the glute med along with strengthening the muscles that support the arch, it's 2 exercises, hip abduction and inversion. Basically should take away anybody's plantar fasciitis. And Diana always loves when I talk about this, but it will stop a bunion. Everyone's wondering what the hell this bunion situation is. And almost everybody, when I find, it's very funny. So someone has left lower back pain and I'm working on their right glute med. And I get to see them when I'm doing these Skypes and Zooms. I'm watching people. And I have to see that their foot is in the right place. And I'll notice, sure enough, where the glute med is on the right side that created, say, the left lower back pain on the right side, you'll see they also have a bunion. And when I mention it, they're like, oh, no, I don't know. I ended up a podiatrist and gave me a cortisone shot or whatever, right? All this stuff. But what you're not recognizing, it's mechanical in nature. The bunion is actually an indication of what is known as hypertrophic bone development. So I want you just to think about this. Remember I said you should be weight bearing on all 5 balls of your feet, but when your glute med weakens, it causes you to weight shift onto the middle of the foot, more the inside of the foot, so you weight bear on the first and second balls of the feet. So you have this excess force load. The bone is experiencing that, the ball of the foot, and the brain says, God, I think you might fracture. And so it says, I don't want you to fracture, so you know what I'm going to do? Because now there is this new force load. I don't know where it's from. I don't know anything. All I know is I feel the force load. I'm going to make more bone to account for the extra force load, right? Doesn't that make sense? So when that happens, the body develops that extra bone. That's what a bunion is, hypertrophic bone development. So if you want to stop a bunion, you don't do anything with your diet. You don't buy a new shoe. You just strengthen your gluteus medius muscle. Think of it as killing 2 birds with 1 stone. If you strengthen the gluteus medius muscle and you strengthen the anterior and posterior tibialis muscles, well, congratulations. You will not get plantar fascia or bunions. Isn't that great? But going back to the Yass method again, I want to just reinforce what's one of the points you're learning here. What's the point you're learning? The cause of your pain is almost never where the experience or the symptom is. Look at what we're talking about here. You're having pain under your foot or a bunion, and the cause is all the way up at the hip joint, the side of the pelvis. What makes the Yass method so unique is that I'm coming at the cause of pain from a functional perspective. I'm saying to you, I know sure as shit that gravity's pushing down on you every time you do an activity. And your body, through evolution, was designed to work a certain way. But with the advent of technology, people just don't do much anymore. And muscles are having a tendency to weaken. And as a result of that, the muscles are most susceptible to straining and eliciting pain. So I try to look at the person, and what I'm confirming is, when do you have your symptoms? Oh, it's associated with the symptom, with an activity. Well, you've just reinforced my position. It is muscular in nature because you're connecting your symptom with a function or dysfunction. And the only thing that can connect that is muscle, right? So once we recognize that, now we have to, and then this is where it gets a little heavy, you got to have a little background in understanding which muscles are required to do activity normally. You have to be able to break functional activities down, like, for instance, walking. You got to know what every aspect of the gait cycle is, the ability to walk. You raise your knee, that's hip flexion. You kick out, that's your quad. You put your heel down, you toe off, you walk through. Every one of those steps has a particular muscle associated with it. So as you watch someone who doesn't walk correctly, you can then differentiate the aspect of walking that's been impeded, where the dysfunction lies, and then be able to understand which muscles are responsible for not allowing that person to walk properly. And you can just see that for just about any activity. The other thing is that when you have muscular deficits, you have postural deficits. Oftentimes, you know, people talk about, I go to a chiropractor, he adjusts me, put something down. The question, the very simple question is, can you actually position a bone and it will stay where you position it? And the answer is probably not, right? You can't move your kidney, your liver, your spleen. A bone is innate. It has no ability to position itself. What positions a bone is muscles that attach to the bone, right? That sounds logical. So if you're having a bone that's not in position, whether it's related to your spine or a joint, well, the only way to correct the posture or the position of the bones is to correct the muscular deficits, weaknesses or imbalances. So that's where the Yass mentality comes from. It's recognizing that you have pain and dysfunction that's associated with muscle. You can probably find a correlative change in posture that's associated with muscle. And so when you put all these things together, that's what allows you to really differentiate what muscle is responsible and what you need to fix. Leander wrote, I have unbelievable pain in my right shoulder blade. A chiropractor and surgeon both told me I needed either traction or surgery. I moved my computer screen. The pain went away. It was all muscular. There you go. Right. That's the Yass. You notice how you went to a chiropractor and you went to a surgeon and they recommended surgery? I mean, I'm not sure if I should try crack, and I go to a crack dealer. I guess he's probably going to tell me, well, from a moral point of view, it's probably not a good idea. So I would suggest you not try crack. I mean, the guy makes money selling crack. He's going to say, great idea. I think you should try it wholeheartedly. What's the difference between a surgeon telling you need surgery? It can't be that confusing. Everybody makes it, and there's a certain act that goes along with it. Well, I'm a conservative fellow, and I think we should wait and try everything that won't work. Well, his experience after multiple years is that nothing does work because it's muscular and nobody knew it was muscular. So he has no problem waiting, or she has no problem waiting until you're willing to fully commit emotionally to it. No one wants to make you feel like they're forcing you into it. But it's just obvious that it's just a game. They're going to tell you what they're educated to know, right? What's the Yass method? Something I know. Something I created outside of a curriculum. There is no Yass method curriculum. Well, I potentially could develop it. I've tried to create forms of it in my books, these videos that I do. I certainly try to make people understand it. But, you know, it's me. That's it. And it's unique, and it's about muscle. In 98% of cases, it's going to work. The nice part is my diagnostic model would actually allow me to know if you really did need surgery. And if you did need surgery, I'd be the first to admit it. But the presentation of the symptoms will tell you that, right? Not an opinion, not a diagnostic test. We don't go there. So we did, I didn't do the knee yet, right? Haven't done the knee yet. Here's a funny one. Here's a kind of cool, funny thing. So a person has pain around the kneecap, right? And, you know, I'll just go a little bit here. They'll say you have a meniscal tear or you're bone on bone, something like that. Who knows that the knee joint is made of two joints? Does anybody know that? I bet nobody knows that. The knee joint is comprised of two joints. Here's the two bones that make up the first joint. The thigh bone and the lower leg bone, right? That's the bone that when they talk about the meniscus and that cushion that absorbs your force, that is between the thigh bone and the lower leg bone. Where's the other joint? The kneecap and the thigh bone, right? Two separate joints, thigh bone and lower leg bone, kneecap and thigh bone, okay? So what do they talk about when they talk about the joint between the thigh bone and lower leg bone? They talk about meniscus. They talk about arthritis or bone on bone. Now, think logically. If your pain is around your kneecap and somebody says the cause of that pain is coming from the joint between the thigh bone and lower leg bone, can that be the cause? I'll give you a minute. Does anyone want to say yes or no? Plug away. I'll do the Jeopardy. Do 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 do. Anybody want to try? Nope. Yes, that is correct, Kathy. Excellent. You had guts. I like that. The answer is no. That's like saying some structural variation at my ankle is going to cause pain at my elbow joint. Nobody would think that, right? That's insanity. And that's the insanity of the knee joint and the way it's perpetuated. It's foolishness. It's craziness, right? So let's talk about, because over the 27 years I've been doing this, it is extremely rare. Virtually never do I come across somebody who has pain at the joint line between the thigh bone and lower leg bone. Virtually never. Out of thousands of people, one person, 2 or 3 people, out of thousands, right? The majority of people have pain around their kneecap. So what controls the position of the kneecap? Well, if we look at the thigh, we'll see that your quadricep muscle, which is at the thigh, attaches on the top to the kneecap versus the quad tendon. Then it attaches from the kneecap to the tibia, the lower leg bone, via the patella tendon. And so the connection occurs amazingly from the pelvis to the tibia. That is the entire mechanism. From the pelvis, the front of the pelvis, you have the quad tendon, you have the kneecap, you have the patella tendon, you have the tibial tuberosity. And that's what happens. So the quad up top contracts, it pulls on the kneecap's attached to the tibia, so it pulls the tibia, right? That's how you extend your knee. Okay? That's what's happening. The kneecap is pulling on the tibia. So what determines the position? I'll give it again. We have the pelvis, the quadricep muscle, the quad tendon, the kneecap, the patella tendon, and the tibial tuberosity. I'll give you another guess game. What muscle is responsible for the position of the kneecap in the knee joint? We'll do the Jeopardy. Hey! Kathy got it again. Quads. That is correct. That's what you want to understand, is that the determinant as to how much pressure and the position of the kneecap in the knee joint is almost exclusively based on muscle. It is the quadricep muscle. So remember we talked about this with the lower back? How you could have your quads be stronger than your hamstrings, right? The front thigh is stronger than the back thigh because that's what you use more of. And it can create a shortening of the quad on the top and cause arching of the lower back. Well, what if the quad was shortened and pulled excessively on the kneecap? That kneecap is going to get jammed into the groove. It's going to be compressed. So when you go to bend your knee, instead of it just lightly gliding, it's compressed in. Wouldn't that create pain at the what is known as the patella femoral joint, the joint between the kneecap and the femur? Wouldn't that cause pain there if the quad had overstrengthened and shortened, pulling excessively on the kneecap? Doesn't that make sense to everybody? So if that's the case, how would anybody, I'll give it again, quad is too strong a relationship to the hamstring. Hamstring's weak, quad is strong. I'll give you true false. To resolve pain at the kneecap due to a stronger quad and weaker hamstring, I would stretch my quadricep muscle and strengthen my hamstring. True or false? Da, 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 da. Anybody want to guess on that one? True or false? Quad is too strong. I'm going to stretch the quad and strengthen the ham. True. Exactly correct. Now, what you're going to be blown away by is the fact I'm talking about you just do that one stretch and the pain in the kneecap is gone. I'm not saying in 6 months to a year. I'm telling you, you stretch the quad, if this is the cause of your pain, for 20 seconds and the pain is gone. And in fact, if you were having pain around your kneecap, why not go ahead and test it? The schmucks want to give you a meniscectomy or a bone-on-bone knee replacement or something. Pain's around the kneecap. What the hell do you got to lose? Stretch your quad and see if your pain goes away. If the pain goes away, did you just make yourself not have a meniscal tear? Did you make yourself not be bone-on-bone? You just change the tension on the kneecap from the muscle that controls it. Boom, done. Stretch that quad 3 times a week. Strengthen your hamstring. Progress that resistance, as we talk about in Yass exercise. Get that hamstring strength equal to your quad strength. You prevent it from ever shortening again. You don't have knee pain again. Done. Not only that, how about the ability to bend, to sit, to climb stairs, to walk? All made better. Functional. Done. Right? That worked for me. I was totally shocked. Yeah, there you go. I'm telling you. This stuff seems shocking. So, you know, the worst part about being me and all this stuff is, what about if the pain is at the bottom of the kneecap? You mean like if this is your kneecap, the bottom here, like this is the quad tendon, this kneecap, this is you might actually have, if it's at the bottom of the kneecap, you might be having patella tendinitis, which is to say that, so remember, anything along that mechanism could become irritated. So you could strain your quad. You could irritate the underside of the kneecap, but you could irritate even the patella tendon. It's just a question of which is being irritated, but the cause is still the same. That quad is too strong. If you were to stretch the quad and strengthen a hamstring, Leander, you would still be able to resolve that. Okay? So don't worry that it happens to be that your pain is coming from the patella tendon versus under the kneecap. The cause is still the same. They're all part of the same mechanism. You could strain your quad. You could strain your hamstring. It's still part of the same mechanism. It is the representation of testing the quad and seeing that it's tight in relationship to the hamstring that lets you know that the mechanism that's failing is that the quad is too strong in relationship to the hamstring. Yeah, I think you're saying the bottom side. Yeah. So hopefully that helps differentiate that. All right. Pain for years gone very quickly. Yeah. The nice part is about all this stuff when it's muscular. What's the greatest part? Who's in control? Who makes you stronger? Can a doctor? Can a chiropractor? Can a physical therapist? Who can make you strong? You. Just you. So what do you need? You need equipment. You need to buy $12 worth of bands. You need a door and a frame and a chair. And then you need knowledge. And that's what I'm here to give you. You get that fixed, you got your life back. And you only need me for a couple of, you just don't need me for that long. I hate to say it. I love to be friends with everybody. But in terms of need, all you need me to do to assist you with is guide you that cause is muscular. Once you determine it's muscular, which muscles are involved, how to perform the appropriate exercises, and finally, how to use progressive resistance, which is really the thrust of what we're trying to accomplish. I think that's why being on a bicycle helps my knee pain. The reason the bicycle helps is that you're just doing exercise and you're warming your muscle up. So the quad, if it is shortened, has an ability to just become longer because when a muscle contracts, you're pumping lactic acid develops, and lactic acid would make your pH of your blood become acidic, so the body wouldn't let that happen. So it's got to pump blood to the muscle that's contracting to get rid of it. Since blood is warm, it causes the muscle to be stretched out. So while you're doing the exercise, your muscle's going to be stretched out. You're not going to have that excessive compression. But 3-4 hours go by, you sit for a while and lay down. Wow, when you go to stand up, are you going to have pain? The pain that occurs from muscular causes typically occurs after the bout of the exercises because you've strained the muscles during the activity, but you're still using them. It's not until after the muscle has a chance to cool down that it'll go to that concentrated, shortened position. Here's kind of a cool thing. I don't think I pointed that out. All right, this is the length of your muscle fiber, and it has 10 pain receptors along it, right? And you don't have pain. Now you strain that muscle, and that muscle shortens down to here. You still have 10 pain receptors, but instead of it being diffused here, it's now concentrated here. Can you see now why that little shortened muscle is so painful? Does that make sense? When it strains, it gets bunched up. That's concentrating pain receptors. That's why it's painful. When you do a bicycle or take a hot shower or put a lidocaine patch on, you're bringing menthol or heat to the area, and as a result, the muscle, even in the short term, will go from here to more of here. You're deconcentrating the pain receptors. That's why doing exercise might, in a period of time, feel like you're okay. But it will come back, the pain, if you haven't done the appropriate exercise to stop the straining from occurring. How many people, I think Kathy, not Kathy, but Diana, you told me, I think, you would go to a physical therapist, you'd feel better, and by the time you're walking out, this is a common story, people say, by the time I'm walking out, I feel the pain coming back. What does that mean? It means that all they did was activate your muscles enough to get some blood flow, but you never addressed the appropriate straining, so as soon as the muscles had a chance to cool down, they just went back to their shortened state. Right? But if you did Yass and we did the appropriate exercises that we need to with progressive resistance, we're eventually going to get these muscles that when they cool down, there's no shortened state to go to because they're going to maintain their optimal length because they're not going to strain. Does that make sense? Is foam rolling good? It's just like applying heat. It's wonderful in the short term. You're going to try to break up a little bit of that knotting. That's the same solution as massage. I don't have anything against massage. Massage is great for breaking up knots. But what's it doing to change the muscular deficit that's leading to the straining, which leads to the knots reoccurring? Nothing. So if you're good with getting massages forever, then that's okay. But you are, in between those massages, going to have bouts of pain. Now, if you want to stop the bouts of pain, you got to strengthen the muscles to where the force outputs are greater than the force requirements of your activities. The muscles never strain, never shorten, never knot. Knotting is the byproduct of the muscle straining. That's a good way to look at it. So foam rolling, listen, I don't have a problem with anything anyone does. But when you want to finally get to the point of resolving the cause, nothing's going to work other than targeted strength training using progressive resistance when the cause is muscular, which it is in 98% of the cases. That happened to me with a chiropractor. They really have no idea. Yeah, I mean, on this particular episode, I'm not going negative, so I will not address that. I just want to make people be better. I want to give people the opportunity to resolve their pain. It is through the Yass method. There really is. I wish there was a magical answer. I know. So, I was going to say before, one of the things that's very funny is that when people do use this, they get better so fast. And then they try to tell people, because everybody knows somebody in pain. They have a relative, a family, a co-worker, a friend, something. And they'll be like, hey, Bob, how'd you get better? Oh, I use this exercise thing. Oh, man, how long will it take? Oh, about 2 weeks. No way. It's impossible. I've been in pain for 30 years. You've been in pain for 30 years because you never identified the cause of your pain and addressed the cause. That's all it is. That's all it is. Nobody believes you. It's ridiculous. Yeah. It's tough. But I've changed my whole mindset. I'm just such a different person than I was a year ago. I used to get very, very upset and just take it personally. Oh, my God, I'm just not a good communicator. Why doesn't anyone listen to me? And the reality is that that's out of my control. I could be Johnny Appleseed because that's all I want to be. I'm just Johnny Appleseed. I'm spreading the seeds. And people are picking them up. I am reaching more and more people. I actually saw, I don't even know if anyone's listening right now, but in a few weeks, I will be presenting my method to the India Rheumatology Association, the actual country's rheumatology association. And the reason is that the president of the association somehow went on and found me and saw some videos, I guess, things of that nature, and said he sees the value in my diagnostic model. And remember, this is rheumatology, which is joints. But he's recognized there's a connection to the soft tissue surrounding joints. And that's what fascinated him about what I'm doing. And so I take this as a massive, massive honor. I have forever wanted to talk to a medical body. And so for this to happen, I think my seeds are reaching people. And I'm excited. And in the meantime, I take people like Kathy, people like Leanda, Diana, anybody, you know, Jennifer that I've helped, all the people I help. When I get this message back that my system worked, it's the greatest gift in the world that I could ever have. How many people in their life can say they have a direct impact on the quality of someone's life? I've worked on people who are suicidal. I have literally given them the chance through this gift of having their life again. It's incredible. It's a wonderful gift. And so that's what I focus on. I will continue to be Johnny Appleseed, but in the meantime, I take solace in knowing for every person that I have been able to have an impact on, it's a gift. It's beautiful. So I feel very blessed. Leander wrote, I can't sit with my feet flat under me, and I can't compress my knee joints so my calves are touching me. Right, you got it. It's not arthritis. It's clearly not arthritis. It's your quads are too tight, right? So for you to bring your heel, for you to sit on your heel, you have to have hyperflexion of your knee. Your kneecap has to go all the way in. Well, that is only based on the distance that the quad is able to be flexible, right? If it's not flexible, how are you going to get this back here? You can't get that back there. This has to be able to flex all the way for you to do that. Well, if this is shortened, that's not going to happen. And you have to appreciate, Linda, I'm talking about if you went 3-4 weeks of aggressive hamstring strengthening, this is done. You'll sit on your heels in no times. Okay? So I think I did a lot. I did the neck, I did the shoulder, the hip, the back, the knee, the foot. Does anybody have any other joints that they want me to discuss at this point about a potential muscular cause? It is a blessing what you do, and it's so hard to change closed minds. I know, but it's happening. It's happening. And you know what? You can't make somebody want to learn this stuff. I've come to learn this. They have to do it in their own time. I've really come to learn. This is the truth. So many people have said, I'm going to tell my brother, my sister about you, or aunt, or whatever. And then they come, oh, they don't care. They don't want to hear about it. And that's okay. That's okay. Somehow, one day, they just might be Googling something on the internet, and this is going to appear. And this is going to appear. And on their own time, on their own terms, they're going to look at this. And they're going to say, wow, this really makes sense. And at that point, they'll probably come back to that person and say, remember you told me about that guy? You were right. It does make sense. You know, 2 months ago, 3 months ago, I was in London. And I was presenting at a big convention that was put on by What Doctors Don't Tell You. 3 months later, I'm in India. Right? I'm presenting. They've asked me to come there, but because of the coronavirus thing, I have to do it through Zoom. I'm going to do a webinar. But they did say that once it clears, I will come there. You know, here's kind of a funny, cool thing. All right, so for anybody that hasn't done it, can you please go on my YouTube channel, Dr. Mitchell Yass. Just put in Google, search Dr. Mitchell Yass, and subscribe. Can you please subscribe and tell your friends to subscribe? Because the more people subscribe to that, actually, it's quite interesting. I never knew this, but I started reading about it. So YouTube suggests videos for people when they put in different search words. And your videos will be suggested to more people as you get higher ratings. So one of the rating mechanisms is subscribers. Another one is impression to click to impression, which is that if you see that I have this video and you click on it to see it, well, that's an indication that it must have been interesting, right? But if they sent it out to a bunch of people and they look at it and they're like, that's in for me, that becomes a low click to impression ratio, and that's bad. And I've noticed that I've been putting out a lot more content, and I try to make it interesting. And I always try to come up with a catchy title, and my click to impression ratio is going up, which is good. But the one that I think I can do most with and help most is the subscription number. So please just go on to Dr. Mitchell Yass on YouTube and subscribe. And if you can, just tell anybody, Google anybody, and just let them know that they do that. And if I get 1,000 people, it actually helps me. They really start pushing me up. So I'd appreciate that. Anyway, Kathy wrote, I keep getting older and stuff keeps breaking, but I really think we can keep up with it. Yes. Yes. So question, does aging and infirmity go together? Do you have to be infirmed as you age? The answer is, anybody? Do you have to get sick when you age? Do you have to lose functionality when you age? Anybody want to put a yes or no on there? Anybody want to go for it? All right, I'll just say the answer. Clearly, no. So there's some stupid commercial out there that's talking about it's a like testosterone supplement company, right? And they say, when you reach 20 or 30 or 40, you start losing testosterone and you lose muscle mass. And forever, people have always said, yeah, no, that's true. Well, I was 26 years old and I was 160 pounds. I am 59 years old and I am 215 pounds. I have the same exact waist, 34-inch waist. I put 60 pounds on, 60 pounds of muscle, 60 pounds of muscle, same waist. So I understand. You just told me I'm supposed to lose muscle mass through these 30 years, and I guess that can't quite be true. So just remember, folks, when they talk about this crap, they're talking about a person who's not willing to commit and participate in their well-being. You participate in your well-being, you could reverse pretty much anything you want. You can't stop aging, but man, can you stop infirmity. My father's 85 years old, doesn't take a freaking pill. Every month, 2 months, that guy is traveling somewhere, does anything he wants. 85. Guy follows weightlifting, golf, or tennis every day, does some sort of activity every day. That's the answer. That's the answer. You want to stay healthy? Stay fit. Are fit people generally more healthy than non-fit people? Does anyone want to disagree with that? That's the answer. Stay active. I'll give you one more kind of cool story. Let me see. Yes, even tennis players who continue to work out get slower. Even Federer. Sure. There's no question that you say that, Leander, right? But think about the high level of function that guy's at, right? So certainly it's going to be fairly tough to sustain that level as you get older, right? To sustain that level. But how old is Federer? He's in his 40s, I think, and he's still winning against 20-year-olds, right? So aging doesn't have to mean you fully lose your competitive edge. You might lose a bit of your functionality, but that's when you're talking about people like that. Their functionality was at such, he's 39, right? Look at that. 39, he's playing guys in his 20s, killing them, right? So functionality comes from strength, and you can sustain your strength. It's the one tissue in the body that is not affected by age. All you have to do is look at Jack LaLanne, 95, right? So, oh boy, I forgot what I was going to mention again. I was going to tell you one more kind of cool story, and I forgot what it was. So anyway, all right. So this was, geez, it's very funny. I always start these things saying I'm going to try and stay on from 30 minutes to 45 minutes. Because another thing that happens is people see it's a minute, like it's an hour and a half now, and they say, "I must suck. It's so long, and I ain't going to keep my attention." But I think this is, to me, this is my little lecture hall. Anybody that knows me knows that I always have perceived myself as a great educator more than a practitioner. So I love to teach. So that's what I see these as. So, but I ran to an hour and a half. Kathy wrote that testosterone is made from bull semen. Just keep your functional level up, and guys will have plenty of testosterone. It's nonsense. You don't have to get into the, what was it? Bull semen. Oh, boy, that's crazy. So, all right. So what else do we need to discuss? Anything? I think that was incredible. This is one of my favorite ones. Thanks for everyone for participating, being involved. And like I said, if you want, you could go on Facebook and become a fan or tell people about that. That's at Dr. Mitchell Yass, at the Yass Method, or just do Dr. Mitchell Yass on Facebook. YouTube, please, 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 please try to get people to subscribe to Dr. Mitchell Yass. On my website, mitchellyass.com, I have the blog there. God, 80 to 100 posts on there already. If you guys want to get in touch with me, or you know somebody that's having trouble, again, if you want, I'll just do one more time. Email. Just stick that on there again. You can take that. And that's about it. If anybody wants to get in touch with me, by all means, I'm always here, always willing to answer questions. Leanda, I'll definitely get in touch with you tomorrow, and we'll set up a Skype in the next 2 weeks. Okay? All right, folks. I think that's it for now. Thanks for joining me. And I have been doing this every week, so you can look for me Fridays at 3 p.m. Eastern Standard Time. I'm trying to make this a consistent thing. And I might be also starting to add in a Facebook Live session every week. I'm just trying to get the word out as much as I can. I'm enjoying it. I'm really feeling invigorated. I'm loving the response. It's going really well. So thank you, everybody, for participating. And let's keep spreading the word. Let's resolve the global chronic pain epidemic by working together and recognizing what causes pain and how to resolve it. We could always do that through the Yass method. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.